ध्यायामो धवलावगुण्ठनवतीम् तेजोमयीम् नैष्ठिकीम् स्निग्धापाङ्गविलोकिनीम् भगवतीम् मन्दस्मितश्रीमुखीम् वात्सल्यामृतवर्षिणीम् सुमधुरम् सङ्कीर्तनालापिनीम् श्यामाङ्गीम् मधुसिक्तसूक्तिम् अमृतानन्दात्मिकाम् ईश्वरीम्
Om Amriteshware Namaha. Welcome to all the viewers to this webinar, Ayurveda Intervention in the ICU for COVID-19. Today we have with us Dr. Ashwath Rao. He is an allopathic doctor. He's completed his MBBS from KMC Manipal. And now he's a junior resident specializing in general surgery at the Bangalore Medical College. Dr. Ashwath Rao has a family tradition of Ayurveda, and he has been guided by his parents. And so with his family background and experience in Ayurveda and his engagement in studying modern medicine, he has been occupying a very unique space. And he has been able to find the situations where Ayurveda and modern medicine can be integrated, especially where in very critical cases, Ayurveda can be added on to improve the outcomes. When we think about emergency and critical care, we think that Ayurveda doctors have to learn emergency medicine to make themselves complete. Ashwath Rao is turning the tables around. He's showing us how Ayurvedic system can also, make breakthroughs in critical care inside the ICU. First of all, I would like to, with all respectful regards, welcome Swami Shankaramrdanandapuri to this platform. Swami is the senior-most disciple, one of the senior-most disciples of Mata Amritanandamayi, and he is also the medical director of Amrita School of Ayurveda. He will bless this occasion with his presidential address in a short while. My wholehearted welcome to Swamiji. Namaste. I would also like to invite and welcome Dr. Ramesh NV. Dr. Ramesh is the principal in charge of the Amrita School of Ayurveda and also the head of the Department of Rasashastra and Bhaishya Kalpana. And today's topic is basically also the application of Rasa medications in critical care. So he's the apt person to give the opening remarks for this webinar. Sir, I welcome you wholeheartedly to this event. We have with us also Dr. Rajeshwari PN. She's Associate Professor in the Department of Shalya Tantra and a very experienced clinician and very keen to share and publish the outcomes of the clinical practice. And she's also from the Department of Surgery, so shares the same specialty with Dr. Ashwath Rao. She will be delivering the concluding remarks today at the end of the event. I welcome you wholeheartedly, to this webinar. So we are eagerly waiting to hear from Dr. Ashwath Rao. So I don't want to take up any more time. I welcome wholeheartedly all the viewers who have joined to, listen to this webinar. I would now like to invite Dr. Ramesh NV, the principal in charge of Amrita School of Ayurveda, to give the opening remarks for this webinar. Welcome.
Om Amriteshwarye Namaha. My humble pranams at the lotus feet of Amma. My pranams to Sampuja Swamiji, Ram Manohar sir, Ashwath Rao sir, Rajeshwari madam, and all the participants in the webinar. And today is one of the happiest day in my life, I can say, because as the participants, majority of the participants being our students, from day one, I used to tell them regarding the integration and utility of the different sciences in the patient's care, as well as the importance of Rasaushadi in management. Uh, I was fortunate enough to complete my BAMS and do a short term course in modern medicine from Bangalore University in 1995, which has given an exposure to me in the modern medicine management, especially in critical care, in ICUs, and in surgeries. So from that day onwards, when 1997, when I started my career as a practitioner, I was always eager to, integrate the both the system in my practice. As I have told earlier, also to my students, we have an integrated registration in Karnataka where I can practice a minimum of modern medicine also, and in a critical conditions, and it's always better to integrate both the system so that we get a better result. For almost 10 years I was practicing in a rural Karnataka place as uh, Koppa. It's a small village where people depend on available doctor for their relief. They don't differentiate much between Ayurveda or modern doctor, and the places are so remote that doctor may have to go in a two-wheeler to their home to conduct the deliveries. So there I have seen and I have practiced for almost 10 years this integrated system of medicine for the patient's benefit. But still somewhere in general perception, we always think that Ayurveda means for a chronic illness and not for an emergency care. And mixing Ayurveda and allopathy, there was always a problem between two communities because of not knowing the values of each system of medicine. And after coming here, even I have experienced people, even Ayurveda people are also more apprehensive about using herbo-mineral preparations, rasaushadis. They're very much afraid. Generally, Kerala follows more herbal medicines for treatment. And why I tell this is my
Yes, sir.
happiest day because, and today we have a person from
Sir, we are in
another
the
branch.
sir, but I am working on that list actually. It's almost ready.
Yeah, today I'm more happy because today we have a person from uh, the other system of medicine, allopathy system, modern system of medicine, who is going to speak about the critical care. It's not an ordinary care, even in a critical care. So he is going to demonstrate in a few minutes about the utility of Ayurveda medicines, even with the so-called improved biomedical technologies and the modern medicine. Somewhere there is a big space for a proper utilization of Ayurveda medicines to bring back the patient. And also being a person from Rasyastra and Bhaishya Kalpana, as I was telling very repeatedly about the importance of Rasaushadis in critical care management. So there is more information regarding the Rasaushadis also. So I always dream of integrating the both the system, because as personally as I have studied, as I have practiced, I have seen uh, the limitations of both the system of medicine and the strength of both system of medicine, and judiciously when we use them together, there is always a better result, and uh, it brings the happiness to us when we see that the patients will recover because of this integration. And I think for all the people, all the students who are there today watching this, uh, I think my opinion, which I was telling from day one, is going to be validated today properly. How far Ayurveda excels in managing even the critical condition by a proper documented presentation today. I hope these sort of presentations will come more and more, and I wholeheartedly appreciate the effort of Team Achara headed by Dr. Ram Manohar for bringing Ashwath Rao sir to the program and allowing all of us to listen his experiences in managing critical cases. I mean, it's not only critical stage, even the chronic stage where other system has got a minimal role. Ayurveda has got a better answer. The proper utilization is always an important, proper analysis of the medicines is always important, which has been told, like योगादपि विषम तीक्ष्णम उत्तमम भेषजम भवेत् भेषजम चापि दुर्युक्तम anartham upajayate. So this quotation, which has been told by our acharyas, is still holds good. Even the so-called visha or poison, properly used, will save the patient. And today you are going to hear this with a proper presentation. I thank Ashwath Rao for spending his time over here for the presentation. I once again congratulate Achara for organizing this program, and I expect all of you to get a good listening. Thank you, one and all.
Thank you very much, Dr. Ramesh sir, for this introductory remarks. Now the stage is getting set, but now we have a very important, talk. I would now like to request Swami Shankaramridananda Swami to, bless this occasion with the presidential address. There is no audio. So we'll just set this problem in a moment. There is an audio.
Namaskar, sir.
Now it is fine. Now it is
okay. Okay, I just finished my prayers. My pranams to Dr. Ashwath Rao, Dr. Ram Manohar, Dr. Ramesh, Dr. Rajeshwari, and all the others who are participating in this program. 2-3 months before, I happened to speak with Amma. Amma was talking about the Ayurvedic medicines for diabetes and some chronic illnesses. And I was casually mentioning that the usual approach of Ayurveda is not very effective in diabetes. Amma immediately categorically refused my statement and told that there are very good medicines in Ayurveda which are to be explored and understood properly, because it is found by the rishis who are having no selfish motive. So whatever we had been so far trying, in the scenario in Kerala is generally they use the herbal medicines. There are about 600 pharmacies in Kerala, but hardly there is any pharmacy which is manufacturing. There are there are 2 or 3 only which are very, very popular. They also manufacture more of Siddha medicines than the proper Rasaushadhis. So generally the Kerala Ayurvedic physicians tend to follow the Ashtanga Hridaya tradition and the Ayurveda tradition of Topical Ayurvedic Shala, which use more of Kashtaushadhis and Kashayas, as well as the strict diet regimens. And very long-term treatments are also followed here, along with the Panchakarma therapies. So when we study, the opinion of our teachers were that, the North Indians use only a kind of a classification. We classify medicines into two. One is dosha viparita and the second one is the vyadhi viparita. Dosha viparita removes the causative factor of the disease. It acts with the tissues and the changes that has happened in the body, and then try to remove that, so that it's a fundamental method of treatment. So we had been taught that that is how you have to try to treat, rather than giving vyadhi viparita chikitsa or like any rasaushadis, without discriminating about the dosha, without doing the dosha nirupana. Just give that medicine so that it cures the condition. So there is a kind of a stigma for the Kerala physicians to practice the rasaushadis in a very useful manner. So from Dr. Ram Manohar, I understood that Dr. Ashwath is belonging to a traditional Ayurvedic family, and is a good user of the rasaushadis as well as the anoshadha chikitsa. In Kerala, there are in Vishavaidya, it was prevalent that they will use Vishavidya as well as Vishavaidya. Vishavaidya means using medicines. Vishavidya means they do not use any medicines at all. For small insect bites and mild poisonings, they treat without medicines. The Namashivaya mantra will be altered. The permutations of these aksharas will be used, and they will be initiated from their childhood for mantras. They will have siddhi or realization of the particular mantra, so that they combine it with their treatment. Whenever traditionally we call it as mani mantra and aushadha, whereas the manis are all not at all used properly. In fact, they are misused. They are used in a very improper manner. Mantra is not at all being practiced. It should be practiced by the doctors as well as the patients. So I got curious about this particular session. So especially I'm not very much aware about what we can use in the ICU. What are the medicines that can be used in the ICU? The support system in allopathy is doing extraordinary service to the society. There is no doubt about that. But a mutual respect also is necessary to be created, so that the ancient wisdom is not disrespected, is not. It has to be properly understood, so that more and more understanding about how we can combine Ayurvedic medicines in an emergency and in serious conditions. So I think this is a new way of thinking. So it's a very necessary for us. Whenever an Ayurvedic doctor or his family members get affected, we seek the support of allopathic system, and that's whether we can combine or whether we should not combine. In chronic diseases also, as Dr. Ramesh was pointing out, it is very, very, very necessary, not only for the rural people, but also for the people who are living in the metros, because they have to travel 3 hours, 2 hours, and cannot adapt to the old lifestyle. So they also need combined therapy in many conditions. Whereas there are many chronic diseases where you need the modern medication, like blood pressure as well as diabetes, etc. And especially in depression, now the cases are increasing, and people are well supported by the modern therapy, so that they can go to work, and the financial burden is not affecting them. So I think it's time to think about these aspects of how to integrate and how the patient can combine the benefits of all the systems. I think in Amrita School of Ayurveda, this is the first time we are loudly thinking about combining both. So I'm happy to welcome Dr. Ashwath for this program. I'm happy to meet you. Welcome to Amrita School of Ayurveda for this program. Thank you very much for your acceptance of our invitation. Thank you.
So thank you very much, Swamiji, for the inspiring words and the encouragement. And now I think the platform is all set. It is quite clear that it is in the interest of the patient that we need to bring about integration. And the integration, when it is initiated from the allopathic side, it has to be both ways. So I think Dr. Ashwath here is presenting a very unique situation, being an allopathic doctor with an Ayurvedic background. Let us hear to him. I would like to now, without wasting any more time, invite Dr. Ashwath to start his presentation. Dr. Ashwath, please.
Namaste everyone. First of all, I would like to thank Amrita School of Ayurveda for giving me an opportunity to share some of my experiences in treating some critical cases and also some chronic conditions. Before I start the session, I would like to seek the blessings of Her Holiness Mata Amritanandamai, His Holiness Swami Shankara Amritananda Puri Guruji, and my gurus. And I am privileged to have gurus from both system of medicine, modern medicine and Ayurveda, who have guided me in the right path to combine the two systems of medicine. And I would like to take this opportunity to thank the patients and their family members who have given me an opportunity to share their reports. My parents, my brother, my family members, my relatives, etc., and my friends, my undergraduation or my post-graduation, who have supported this wholeheartedly and guided me. Thank you. With this, I would like to begin some of my experience of treating COVID cases, beginning from mild cases to moderate to severe cases. So initially beginning with the case history goes like this. A 26-year-old female was admitted in COVID green zone or orange zone. The patient was very stable initially. She completed almost 6 days of treatment in the hospital. It was almost actually mild pneumonia, and the condition improved day by day. Her symptoms improved day by day. The blood counts normalized, infection WBC count normalized, and her fever, even she had symptomatic and laboratory values also improved simultaneously. So, but on 7th day, we know most of the time, this is the second phase during the cytokine storm. So during cytokine storm, suddenly the condition of the patient deteriorates. In such a condition, patient cannot be managed in green zone or in the stables where the patients are seen usually. So immediately she was shifted to intensive care unit. And when she was shifted, her saturation was just 77 and she was gasping. And immediately she was put on 100% FiO2 with NIV. And the saturation definitely came to 97, 98. And in such condition, if I find, if there is an opportunity or if the patient is convinced about the need for Ayurveda treatment, I take written informed consent. So any patient in ICU or when I treat in any other case in private hospitals or in allopathy hospitals, I take written informed consent of the patient, and only if they are convinced and if they agree to sign the written informed consent, I start Ayurveda treatment. So similarly, she agreed to start Ayurveda treatment, and the first photo shows this was a saturation at room air initially before she was shifted to ICU at room air. So and immediately I started treatment, especially as you know when the person is gasping or breathlessness. I usually don't give any tablets because to avoid the risk of aspiration. So usually I have medicines ready form in powder form or in tablet form. So I started medicine in powder form. I dissolved it in water and started giving it every 15 minutes, keeping in mind the concept of loading dose. Initially, I give very high dose every 15 minutes for 1 hour, and then once in half an hour for next 2 hours, etc. And within half an hour, she started feeling better. Her tachypnea came down. And the second photo shows this after 90 minutes in room air. When I disconnected the NIV, her saturation never fell below 89. It was almost fluctuating between 89 and 90. So there was rapid improvement in her room air saturation on room air. So, and usually when a patient is shifted to ICU, usually they spend for at least 1 week or 10 days, etc. And the feedback what I got from my anesthesia friends who were doing ICU duty, what they said was the requirement of FiO2 or the requirement of ventilator came down drastically. And within 2 days, she was shifted from NIV to NRBM mask. NRBM trial was given, and within 72 hours, she was shifted from ICU to ward. So this is one example of a mild to moderate case which was successfully treated by integrating the two systems. The second case is of moderate COVID pneumonia. She presented with severe acute respiratory infection, and initially, actually, soon after she came to the hospital, within 2 days, she was shifted to ICU, and once her condition got stabilized, within a span of 1 week, she was shifted back to ward. But once again, in the ward, after coming to ward, maybe around the 4th or 5th day, as I remember, her condition started deteriorating. It was in the month of April. We know the condition was worst. No beds were available. Even when the person was in green zone, there were no beds to shift the patient to ICU because the ICU was already occupied in the same hospital. At the same time, outside hospitals were occupied. There was no provision to shift her to ICU. And I had duty from 3 a.m. to 9 a.m. And when I went to rounds at around 3:30, her saturation was just 65 with 15 liter of NRBM mask. And she was gasping for breath. She had crepitations, bronchi, and she had severe chest pain. She was feeling uneasiness, and even she was feeling drowsy. So at this stage, even the to her very next bed, her husband was admitted. So it was very easy for me to counsel them and take the consent. Otherwise, I had to call their family members and explain over phone. It's very difficult. So it was easy for me. It was very easy to convince them, and immediately I started Ayurveda treatment. And within 12 hours, this is the feedback I got from the patient. Her chest pain completely disappeared, and even the dyspnea had come down significantly. And definitely after 48 hours, she was I think after 48 hours she was shifted to orange zone with the NIV. She was given NIV around 80% FiO2, and within this is the second photo shows after 4 days she was maintaining saturation with 8 liters of NRBM 98. So keeping these two cases in mind, I would like to convey some things. Usually the advantage of integration, whether the patient is in orange zone or in red zone or moderate or severe or mild pneumonia, we can assist faster shift of patients from intensive care unit to ward. As we know, more the time the patient spends in intensive care unit, more the cause of secondary bacterial infection. We have to start them on antibacterial, and again there is a chance that they might develop resistance. So especially in the time where the pandemic is very severe, or when the pandemic is at its peak, faster shift of patient from ICU to ward will make a very big difference. So it will open up the beds for people in need. So coming to next case, this is the case history goes like this: 30-year-old female, 1 week of hospitalization in ward, and her condition deteriorated day by day. And she was shifted to ICU. She was maintaining saturation with 100 FiO2 around 97, 98. But day by day, even after spending almost 15 days of ICU treatment, her condition deteriorated day by day. All the course of remdesivir antibiotics were given, but persistently her counts went on increasing day by day. And her saturation, even with 100% delivery of ventilator or FiO2, her saturation started dropping to 70, 80. So, and in such condition, especially usually doctors will not wait the saturation to drop to 40. When the saturation drops down to 70 or 60 with maximum non-invasive ventilation, they plan to intubate the case. So, but the previous week I had done the duty in the same ICU. So my friends had seen about the previous two cases, how effective Ayurveda medicine was in treating critical patients. So as we know, most of the times anesthetists tend to avoid intubation because in COVID, we say intubation is the end. The chance of recovery is just 1%, 2%, it varies from place to place, but not more than 5% the chance of recovery. And once a person is intubated, the treatment becomes very difficult. Even, for example, if I have to give Ayurveda treatment, I should insert Ryle's tube, and it is a bit cumbersome. So, and I got a call at around 7 p.m. that saturation 80-70, we are planning to intubate. You can try a medicine before that. If she improves with 1 or 2 hours, definitely intubation can be avoided. And immediately I reached within half an hour wearing PPE kit. By 8 p.m. I was inside the hospital. And when I reached there, her saturation was just 42. She was gasping for breath, and she was almost drowsy, very much uncomfortable. And in such a situation, I had to counsel the treating physicians and even the family members. And it was almost such a confusion, like whether to intubate or not. So I convinced the family members and the treating doctors that I will try for just half an hour or 1 hour, not more than that. And if it doesn't work, definitely we'll think of something else. So same case as before, I gave some sublingual preparations in Ayurveda, and some powdered medicine, as she was not in a position to swallow any medicines. So within 1 hour, her saturation shot up to 76, and she became a little comfortable. And all the treating doctors felt, yes, this is some improvement, but she can desaturate anytime soon. So I continued my intense treatment. In this case, I gave the medicine every 5 minutes at a very high dose. Usually, people are very much afraid to give Ayurveda medicine at a high dose. But here I want to disclose that what medicine, the recommended dosage, what we give in a span of 15 days, I had given it in 12 hours. So, for example, this is after 2 hours of Ayurveda treatment, the saturation went to 91, and she was immediately put up to prone position, etc. With the combination treatment of Ayurveda and modern medicine, saturation went to 91, and she got stabilized after 2 hours. But the saturation was still fluctuating from 90 to 80, 90, 80, but it never went below 80. This was a very good sign of improvement, the stability that was setting after treatment. And I almost stayed for almost 16 hours in the intensive care unit, usually wearing the PPE kit, because if I come back home, it's not easy to go back and treat again. So till the patient got stabilized and the saturation got stabilized around 90, only then I returned from ICU. So, and most of them were worried, okay, this is some temporary improvement, but what about the toxicity issues of Ayurveda, etc. So, another important, interesting improvement is the interleukin. This was done on 19th May at around in the evening. So it was 387. If you see, within 12 hours, the interleukin has come down to 14. This is such a drastic change. Usually, what we say is the interleukin is around 500, 400, 500, and if the X-ray is bad, the chance of recovery is almost nil, or you say the recovery is very, very low. This is a very much direct evidence to say that how Ayurveda is effective in immediately decreasing the inflammatory markers. And another big worry everyone had was the risk of RFT or LFT derangement after starting Ayurveda treatment. But I have examples of many cases which after I started treatment using Ayurveda medicines, deranged LFT or RFT got corrected after starting Ayurveda treatment. This is a very good example of that. Before starting treatment, the AST/LT was on a higher side, but after three days, even after giving such high dose at such a high frequency for the 12 to 24 hours, and then I taper the dose, obviously once in 4 hours, once in 6 hours, and QID for next 4 days. In this way, I taper the dose. But even in spite of giving so high dose of Rasaushadhis, AST and ALT were normal, and even obviously creatinine, if you see, it is almost it is normal. And in spite of what I saw was, in spite of all the antibiotics that were tried in the 15 days of her ICU stay, her total counts were rising day by day. And teicoplanin, colistin, meropenem, all the higher antibiotics were tried. But in spite of that, her total counts did not come down. She had persistent fever, diarrhea, sleepless nights, even symptomatically she had suffered a lot. And after starting after 3 days of Ayurveda treatment, her counts came down significantly lower side, almost normal, 11,000. And after starting Ayurveda treatment, the symptomatic improvement I would like to put forward here, she had no episode of fever. The diarrhea, what she had completely stopped. She had a very good sense of comfort. She had very good sleep. She said she did not sleep from the last 1 week in intensive care unit. She had a very good sleep. The very next day we started Ayurveda treatment. In this way, even if you see the laboratory values or the symptomatical improvement was tremendous in this case. And after this incident, the treating doctors in ICU, if they find a similar patient who is doing bad, or if the patient is deteriorating, they convince the patient, modern medicine people, either from the Department of Anesthesia or Department of Medicine, they convince the patient party the need for native medicine. Instead of calling alternative, I would like to link it as native medicine, Ayurveda, and they connect them by giving my number. So in this way, we are working as a team. So at this point of time, I would like to inform that I did not work as a single person in the ICU. Whenever the patient is gasping for breath, the only aim of the doctor, it does not matter what system of medicine we are practicing, is to get out the patient from crisis. It does not matter what system of medicine we are using. This was the mindset of doctors working in ICU. We have seen n number of deaths at a very young age since last 1 year. People have seen that working in ICU. So in such way, I would like to thank the treating physician in the ICU, the nursing staff, etc., for supporting this wholeheartedly. They gave their 100% support in treating this case. And I feel, looking at this report, when Ayurveda has the capacity to treat patients, even in intensive care units, it is wrong to it is wrong to keep Ayurveda just for hospitalized, non-hospitalized patients or mild to moderate cases. Ayurveda has the capacity to treat even patients in crisis or the standard line of treatment where the patient is not responding to the standard line of treatment. Ayurveda definitely has a scope to rescue the person from crisis. And looking at these reports, I had shared with my seniors, my colleagues working in different hospitals. Recently, an oncologist working in one of the premier institutes of our country contacted me. He had a person with acute myeloid leukemia who was actually gasping for breath from last few days, who was in sepsis, multi-organ failure, etc. And his oxygen requirement was 15 liters from the past 1 week. And immediately after starting Ayurveda treatment, within 36 hours, the requirement came to 2 liters of oxygen. So, and not only from different parts of the country, even my friends working in different private hospitals here in Bangalore, my relatives, etc., they contacted me when their friends or family members were in intensive care unit or their condition was critical. And there is a lot of similar documentation where we see after introducing Ayurveda medicine, the patient has rapidly recovered. And another improvement what I saw was post-COVID treatment. As we know, in most of the cases, before that, this is actually myself with Ayurveda medicines. And sometimes, as I said, to stabilize the patient, it is very difficult to stay wearing the PPE kit for almost 14 to 16 hours. But when coming out from intensive care unit, the satisfaction is immense, not only to me, but all the treating doctors. We all celebrate the recovery of the patient as a team, irrespective of the medicines that we have given. This is the only outcome we wish. We don't bother whether the person improved using the help of Ayurveda or allopathy. When we work as a team, the spirit is immense. I would like to thank the institution where I'm studying, where the faculty, the higher authorities have supported me wholeheartedly. And even I would like to thank my friends for guiding me. For example, when the patient is in ICU, in case of multi-organ failure, they guide me at present what has to be targeted first. If the mean arterial pressure is around 60, first they advise me to increase the mean arterial pressure, then automatically the urine output will increase. Then you can start Ayurveda medicine, like diuretics in Ayurveda. So this is how they guide me to even give Ayurveda medicines. I'm very much thankful to them. And even not only COVID, at present, as we know, the second wave of COVID, the number of intensive care admission has increased. Or in other words, the severity of COVID has increased when compared to first wave in the second wave. And similarly, as the information I got, the sequel of post-COVID fibrosis also has increased to a very great extent. This has put people to a very big trouble. So, for example, not only post-COVID fibrosis, there were many patients who were oxygen dependent even after 1 month, 2 months after discharge from home, either on home oxygen concentrator or oxygen cylinder, etc. And after starting Ayurveda treatment, within 1 week, they were able to walk without oxygen. So even post-COVID treatment, not only emergency treatment, post-COVID treatment also can decrease the burden to a very great extent. It can increase the quality of life. This is one such worst post-COVID fibrosis, which I treated recently. The first photo shows on 9th June 21, where a 60-year-old female, the history is 1 month before she got discharged from hospital, and it was actually the condition was a little mild. She responded very well to the treatment, and she got discharged with nothing much complications. After 1 month after discharging from the hospital post-COVID, she developed breathlessness, chest pain, etc. She was immediately rushed to the hospital in the in the end of April, and this is the X-ray. X-ray showed which was taken every week just to see the improvement in the treatment. One such X-ray was taken on 15 June, which shows the intensity of the disease: entire lungs, bilateral lungs, extensive involvement, fibrosis, interstitial lung disease. So, and her requirement was 40 liters of oxygen with 70% FiO2, and the condition was so severe that even if the HFNC, she was on HFNC, so even if the oxygen was removed for 30 seconds, saturation is to drop to 50. Such was the severity of the condition. And as we know, when the person is connected with HFNC, we cannot ship the patient for CT scan. So even getting a CT scan was difficult because we can get only portable X-rays, but not portable CT scan inside the ward. So, but they even repeated a portable, got a portable echo, and they did the echo done. So this was the first image shows echo was done on 6th June, which showed severe pulmonary artery hypertension. And before this, I should inform here that the doctors had advised her lung transplantation is the only solution for this. There is no other way out. So, and hence the patient party were discussing the pros and cons of lung transplantation, where it is best to be done, etc. So when the patient came to me on June 10th, I counseled them anyway. Transplantation cannot be done on an emergency basis. Definitely, it will take some time. So at least a span of 3 months. So why can't we try Ayurveda medicine? There's nothing harm in trying. Instead of sitting idle, it is better to try Ayurveda medicine. If the person improves, it's well and good. There's nothing to lose. So, and echo was done on June 6th, and it showed severe pulmonary artery hypertension with pulmonary artery systolic pressure of 75, which corresponds to severe pulmonary artery hypertension. So, the condition of the patient was she had completely lost her voice because of decreased lung capacity, and she had severe chest pain. As we see, there is a left ventricular hypertrophy. She was bedridden for almost 3 weeks. She could not get up from the bed. She was fed in supine position itself. So, and I started treatment on 10th June. And within 2 days of treatment, and this treatment, the modern medicine doctors were not aware of it because the patient stayed in special ward. The doctor used to administer the medicine every 6th hourly. So after almost by the second day of Ayurveda treatment, she had some improvement in her voice, and she could get up and sit on her own. This is the improvement they saw on the second day. And after 5 days of Ayurveda treatment, the treating doctors found some unusual improvement. When they came for rounds, she herself got up from the bed and sat in a chair. So they said this is some unusual improvement. So let us repeat an echo. And as we know, in case of post-COVID, such a severe fibrosis, the severe pulmonary hypertension is almost irreversible. Even I spoke to some of the pulmonologists, my friends who had treated such cases. They say severe pulmonary hypertension with some of the medications like sildenafil, nintedanib, or Perfinex, or antifibrotic agents, or medicines to decrease the pulmonary hypertension, along with high flow oxygen, it can be from severe, it can become mild after prolonged treatment. But this is just after 5 days of treatment, they repeated echo. Severe pulmonary hypertension has become mild in a span of just 5 days. And corresponding to it, even the pulmonary hypertension has come to just 39. So, and another big difference is after 3 days of treatment, the chest pain which she had from almost 3 weeks has completely disappeared. Symptomatically, she was much better. And I spoke to the patient son almost 3 days back. Now she is on just 6 liters of NRBM, that too intermittent, and she is on nasal cannula with connected to oxygen concentrator. Such a drastic decrease in the requirement of oxygen shows the effectiveness of Ayurveda in even reversing the need for transplantation. At present, we are campaigning only for we are motivating people to donate their body so that people who are in need of transplantation will get the benefit. I think at present, time has come to campaign for an integrated approach, and we can even campaign that wherever there is need for transplantation, we can reverse it using Ayurveda medicine along with an integrated approach. And definitely, especially in the second wave where the post-COVID fibrosis incidence is very high, this can make a very big difference. This can improve the quality of life and decrease the mortality to a very big extent, I feel. And this is her CT scan. As I said before, once she was shifted from HFNs, as we know, high flow nasal cannula, there's a big apparatus or a device which cannot be disconnected or taken to CT scan room. Once she was disconnected from HFNC, a CT scan was done with, she went with 8 liters of NRBM mask on 2nd July. If you see the second half, extensive areas of fibrosis, even bilateral lungs, this was the severity. And even we know in case of COVID, the radiological improvement will be little delay when compared to symptomatic improvement. So definitely, I think if we compare the present CT July or maybe after another 3-4 months, definitely there should be very good improvement, even radiological improvement. These are some of few of my documented experience regarding mild, moderate, severe cases and even post-COVID sequelae.
So, thank you very much for that overview of what Ayurveda can do in mild to moderate COVID as well as severe COVID and also in the post-COVID phase. So I think this is very, very important. Could you throw a little bit more light on, what is the scope of Ayurvedic interventions in post-COVID recovery? Because a lot of people continue to suffer with, compromised lung function, and they are sometimes prolonged dependence on oxygen, and at home still bedridden. So, what is the scope, of Ayurveda based on your experience? You think this is something that should be really, pushed forward? Perhaps studies should be done. What is your opinion?
Sir, definitely. When it comes to post-COVID management, especially we see now many people are dying because of myocarditis or mucormycosis, etc. When we start Ayurveda treatment during the, especially for COVID treatment, the immunity of the person will not go down. For example, as it happens when we administer steroids, etc., they are prone to secondary bacterial infections. That is the reason we are seeing the growth of mucormycosis. So I feel even secondary bacterial infection or immunocompromised state can be avoided to a very great extent using Ayurveda medicines. At the same time, as I said, one thing what I felt was even after the recovery, patients felt some sort of uneasiness, breathlessness, even when they went for half-kilometer walk. The tiredness was too much. In such cases, I found very good symptomatic improvement after starting treatment within 1 week. So, and even I think there needs to be a serious thinking regarding the policy formulation. As I said before, when Ayurveda has a capacity to play such a big role, even starting from intensive care unit to from mild to moderate cases to intensive care unit to post-COVID rehabilitation, I don't feel it is right to keep Ayurveda just for non-hospitalized patients. Definitely, we need to take it forward, I think.
Yeah. I think this is a very important point because through all these policy that has been formulated in the Ayush response to COVID-19, Ayurveda has been, restricted to just management of mild and moderate cases. So here it's not a question of one system versus the other. It's a question of how the patient can benefit. This COVID is creating such agony and such tragedies in families. So I think from that point of view, so I have a question here. So what do you think is the relevance of allopathy and Ayurveda, in terms of where should they manage independently? Were you able to make some, clear perspective on this? I mean, where should we combine? I'm sure you will also agree that all these ICU facilities are also helpful. So it's not that Ayurveda can always manage it completely on its own or modern medicine can. Where do you think they should work independently and where should we cooperate?
Sir, I feel we should all realize, doctors from all systems of medicine, that no system of, as Ramesh sir previously mentioned, no system of medicine is complete within itself. And interestingly, there was a conference at Mayo Clinic in the 1990s to decide what should be the quality of a physician, and or what is the quality of a best physician. In the end, after 3 days of conference, in the end, it was decided that a doctor who understands the limitations of his system of medicine is the best doctor. So I think instead of the time has come, instead of trying to become experts in our field, we need to understand the limitations of the field which we are working in, and try to take the help from other systems of medicine. So, and when it comes to, I feel integration. For example, in such critical cases, what some people say, why can't you disconnect the ventilator and give only Ayurveda treatment? Or I cannot treat the patient at home or at Ayurveda clinics. So both are system. At the same time, I cannot allow the patient to die because he is on non-invasive ventilation and I cannot give Ayurveda treatment. Now, at present, integration has been wrongly depicted as mixopathy. So this is the reason behind this is usually people study only one system of medicine and fail to understand the effectiveness or utility of other system of medicine. So in such cases, I feel we should just sit and discuss where we find a difficulty in where there is a roadblock towards smooth progression of the treatment. For example, antibiotic resistance is a very big, as I said before, is a very big headache for modern medicine doctors. In such cases, we can take the help of Ayurveda. The same medicine which was effective 3,000 years back will be still effective for next 3,000 years. As we know, we are not ready to cope up with the new generation antibiotics as fast the antibiotics or the organisms are developing resistance. So this is definitely a serious roadblock in treating infections. So in such cases, we can take the help of Ayurveda. Or, for example, when we want rapid improvement in general immunity, where the patient is at a risk of developing secondary infections like mucormycosis, Ayurveda can be of great help. At the same time, I feel there are some areas where when we treat one condition, the other system might get damaged. When it comes to modern medicine, it is inevitable. So in such conditions, we want only the effects, but not the side effects. In such cases, to shield the side effects of allopathy medicine, we can use Ayurveda side by side. So, and I feel the way the two system of medicine, they work is entirely different. So as it comes for our experience of 35 years, there has been no such interaction, drug interaction or drug toxicity, etc. So I feel, as I've discussed with experts from both the fields of Ayurveda and allopathy, modern medicine, I don't feel there should be any roadblock thinking that there will be some interaction, etc. Both of the systems of medicine can be combined wherever it is required without any hesitation, I feel.
Yes, so yeah, thank you. I think that is a very important message, and I think this is a very important area that we need to work together in the future, create an integrative framework. And now, what I want to ask is, this has been very exciting, very insightful to know. Many of us Ayurveda physicians have also had a little bit of experience in treating critical cases. I have also followed some Ayurveda doctors doing that, giving the basma sublingually and oxygen dependence getting reduced. But to be able to do this in an ICU setting really requires cooperation and collaboration.
Yes.
Now, what I would like to ask you is, yes, COVID-19, yes,
Sir,
of course.
sorry to interrupt you. Actually, I wanted to make one important point with continuation to the previous.
Yes, please.
So actually, many people ask me, how right it is to, treat patients, using Ayurveda medicine in an allopathy setup. Are we ethically right? Does law permit it? Etc. A lot of questions will definitely creep into people's mind, and I want to give some clarification regarding this issue. When it comes to law has given the permission for a physician, especially when the patient is in the condition of imminent death. For example, I cannot take the consent before intubation. I first intubate and then take the consent of the family members. So in such conditions, in emergency condition, as a physician, for me, humanity comes first, then comes law. So same thing applies when the person is gasping for breath. I cannot think whether I'm using Ayurveda medicine or allopathy medicine because law does not allow me. And law has given me the liberty. It has stated that whatever action done by the physician, keeping in mind the interest of the patient, is not a crime. So, as I feel, maybe as we progress further regarding integration, we can change the law later, but we cannot get back the lost lives. So, and I feel most of them who ask me, out of 10 people, maybe or 100 people, 90% of the allopathy or the modern medicine doctors supported me. 10% of them asked, "Are you how right ethically?" All these questions. I asked them one question, but I did not get any answer till now. We speak of ethics, law, etc. only when if the patient is, if you think it is someone else. What if the patient was our own family member and he is in a very critical condition? I just want someone to give the medicine and save that patient. We speak of law, etc. only when we consider patient as someone else. If you consider every patient as our family member, we just want to save that patient, irrespective of the system of medicine, I feel.
Very well said. That's the key point. That is the basis of ethics, ultimately. So now I just want to ask you about non-COVID cases also. I mean, I'm sure it's very tempting now to ask whether you have had experiences in other non-COVID cases also in such situations. Not only, also, I mean, in critical conditions other than COVID, have you been able to use Ayurveda effectively?
Definitely, sir. I would like to make use some of the cases as examples.
Sure, sure.
Here, the patient is none other than my mother's uncle, residing in Udupi, 82-year-old male. He was diagnosed with stage 4 COPD since 2011. And as we know, in case of stage 4 COPD, even if we take the patient to Western countries, the patient will not survive for more than 2 years, in spite of using ambulatory or home BiPAP. This is the severity of the condition. And I joined MBBS to KMC Manipal in the year 2012. So since then, from 2012 to 2020, he was shifted more than 10 times to intensive care unit. And as we know, in chronic obstructive pulmonary disease, the usual sequence is whenever there is seasonal variation or even without seasonal variation, they are prone to develop acute exacerbations. In such conditions, he was immediately shifted to intensive care unit, to the emergency unit, and then from there to intensive care unit. And all these times, at least a dozen number of times, I treated him from the very day one inside ICU using Ayurveda medicine. And within few days, he was shifted back to ward, and few days spending in ward, he was shifted back to his home. This continued for almost around 12 to 14 times, as far as I remember, till the year 2020. So, in the year 2020, when the first wave of COVID began, in the month of April, he had similar worsening of health. By that time, as we know, asthmatic people or COPD patients, they have a higher chance of acquiring COVID infection. So, in such cases, we all family members sat and discussed the pros and cons of shifting him to intensive care unit. So at the same time, their family members also gave us the consent to try some of the emergency medicine. And obviously, if it doesn't work in a span of half an hour, 1 hour, let us take him to intensive care unit. So, and when I got the call from my grandmother, the saturation was just 30 with 2 liters of home oxygen concentrator. I asked her to increase the saturation to 5. That is the maximum capacity, 5 liter. Sorry, the oxygen delivery to 5 liter per minute. And with that, the saturation came to 42. And immediately I rushed. Within 15 minutes, I started Ayurveda treatment. As I said, he was not in a position. He had all symptoms of carbon dioxide retention like CO2 narcosis, tremors, dizziness, etc. And in such conditions, as we know, we cannot ask the patient to swallow the tablet. So similarly, I used, like in other cases, I use sublingual preparation in this condition. This is a administration below the tongue, rubbing the medicine to the gums, etc., where there is very high blood supply. It can bypass the fast metabolism, like how we give sublingual nitrates. So the advantage of this method of delivery is the requirement of medicine is very little, and it can be given even in unconscious patient, and the action is very much rapid. So this is actually after 20 minutes, the oxygen shot up to 99. So I did not give him any other extra treatment other than sublingual treatment. Of course, he was continued with 5 liters of home oxygen concentrator. And this Second photo is next day morning. And this is one example to say that Ayurveda medicine, most of them have the doubt like whether Ayurveda medicine will be of help in emergency condition. They say emergency condition require modern medicine. Once stabilization is done, then Ayurveda has to be continued. But definitely where there is no option to shift the patient to intensive care unit, definitely in many of the cases, there is a very good scope for Ayurveda, maybe in remote cases where we can train the primary healthcare physicians for emergency Ayurveda medicine till the patient is shifted to the hospital, or in case of, for example, in case of cardiovascular conditions, we can increase the golden hour. So that itself will make a big difference in the survival or the recovery of the patient, I feel. And even in such case, I feel like in case of COPD, pulmonary fibrosis, where lung transplantation is a solution, definitely Ayurveda treatment will be of great help. And I would like to take this moment to thank the family members, our family members, for giving me an opportunity to look after him for 9 years since I joined KMC Manipal and joined my PG. I learned a lot of things because of him, and it is because of his blessings I feel I'm able to treat other patients successfully. I'm very much thankful to all his family members. Thank you. And this is another emergency situation which I faced in intensive care unit. The history was patient was admitted around in the month of July in a private hospital around 350 kilometers from KMC Manipal, and it was a case of retropositive. She had gone into, if you see the reports, urine shows polymicrobial growth, varicella zoster, PCR positive in CSF sample. She had endotracheal tube even culture showed positive, and her CD4 count, she was heteropositive, and her CD4 count was at the least possible level at 7, at least it should be around 300. In such an immunocompromised state, she had fungal, bacterial, viral, protozoal sepsis, all the possible sepsis a person could have. And her WBC count was 3000. And when I checked the file from last 3 months, actually she was not taking any antiretroviral treatment. And her, the age of the patient was just 44 years. Her WBC count was never above 3000. It was fluctuating between 2 to 3000 from the last 3 months. Actually, in such cases, in case of multi-organ failure, her creatinine was very high. Even potassium was fluctuating between 6 to 7. She was not responding to any of the treatment. In such cases, it is very, very difficult to rescue, even using any system of medicine. But even patients got the news that I had treated many other cases. So even though in such conditions, I cannot deny the treatment to the patient. So in such conditions, I thought, why can't I try this Ayurveda medicine? So as the patient was intubated, I gave the medicines through rice tube. And to our surprise, and I started treatment on 2nd August. And within 48 hours, the WBC count shot up to 9,800. So this is the good part of it. But the sad end is, as I said earlier, she had hyperkalemia. The potassium was very much high on the higher side, and she had cardiac arrest and succumb. But this shows that, especially in case of dealing infections, as I repeatedly say, when it comes to handling infection, instead of she was put on antifungal, antibacterial, antiviral, all the agents, but single tablet in Ayurveda can take off all the microorganisms. This is the advantage. As we know that once the cellular immunity is altered, these are all broad spectrum antibiotics. To explain in other words, I feel the medicines used in Ayurveda, in case of sepsis or any infection, these are a broad spectrum, like it works like broad spectrum antibiotics. So the need of multiple antibiotics in the same setting can be avoided to a very great extent. So I think this result should open up the doors for further workup, especially in immunocompromised, as I said, retropositive patients who are prone for repeated decrease in CD4 count and immunocompromised state. We should work a lot to improve their CD4 count or their immunity. Even when they're compliant with the antiretroviral treatment, the counts are usually very low in many individuals. I think just by integrating 10% of Ayurveda treatment, we can decrease 90% of the suffering, especially in these cases, I feel. Another interesting case who had come to Kasturba Medical College, Manipal, with history of epistaxis, and on further investigation, it was found that he was having acute myeloid leukemia, and acute myeloid leukemia in crisis. As we say, if the blast count is more than 20%, or in simple words, the malignant cells were more than 80%. When the blast count is more than like this condition, it was 80%. And person was in multi-organ failure. He had deranged RFT, LFT, he had epistaxis melena, and even he had picture of pneumonia. So in such condition, as we know, when the parameters are deranged, we cannot start chemotherapy or plan for bone marrow transplantation, etc. And the patient was just on supportive management, that's all, just for pain, IV fluids, or hydrocort, etc. So in utilizing that, and for example, diagnosed on 2nd July, and I started treatment on 12th July. So our purpose was to just give palliative care, and at the same time decrease the need for repeated hospitalization. The patients wanted to immediately discharge from the hospital and start treatment. I said it is very important to stabilize the patient, so it becomes easy for us to take care of the patient at home. So after the patient stood for around 2 days in the hospital and got discharged, and within 24 hours, epistaxis and melena stopped, which was there from last 1 week, has stopped in the span of 24 hours. And his platelet was also very low, other parameters which I did not put up here. Platelet was around 20,000, and his HbA1c was 12, or glycated hemoglobin was 12. In such a condition, we started treatment. And he went back to his native place. And within 3 days of treatment, he improved dramatically, and he was able to ride two-wheeler in a span of 10 days. So, and even the doctors and the patients, both of us got curious. So I asked them to repeat the blood test instead of coming back to Manipal all the way here. I asked them to repeat the blood test in the nearby lab. And interestingly, once the blood reached the laboratory sample, within 1 hour they got a call. They asked, do you have any, like, are you confirmed that you are a acute myeloid leukemia diagnosed patient? So, and they got the doubt because they could not find any blast count, which was 80%, as I showed in the previous picture. They could not find any blast count. Then the relatives had to provide the bone marrow picture, etc., which had confirmed acute myeloid leukemia. And they gave the report as 1% because they thought they might have missed something using microscope. So in such, even though they could have given it as 0, they felt the person has not taken any chemotherapy, so it is impossible to become 0. So they give it as 1%, approximately 1%. If you see, this is actually, the date is 29, less than 20 days after starting Ayurveda treatment, where the patient was in crisis. The RFT almost has come to normal. The deranged creatinine also has come to normal. And HbA1c from 12 has come to 8 in a span of just 20 days. This is one very good example of treating multi-organ failure using Ayurveda, only Ayurveda treatment in this condition. And the sad end to this, for example, it is when it comes to, for example, if the patient had planned for chemotherapy or bone marrow transplantation, or if the patient is poor, definitely there will be a lot of campaigns happening. NGOs will collect around 20-25 lakh and set the patient for the further treatment. But as you know, when we treat such conditions in Ayurveda, we should go full-fledged treatment. We should give full-fledged treatment. It had cost at least 30,000 per month. So in such conditions, when the patient goes for Ayurveda treatment, there will be no people or NGOs to support such causes. This is the reason we have set up a cancer foundation. I will tell about it later, in order to support such people. So after he was doing very good for next another 1 month, and he felt when he's doing fine, why should he continue the treatment? As we know, especially the dreaded form of blood cancer, that is acute myeloid leukemia, can relapse anytime. Treatment should be continued, intense treatment should be continued at least for a span of 6 months to 1 year. Then definitely we can taper the medicine. And even they found difficult to afford the treatment, so they stopped the treatment. After another 1 month, the same AML relapsed actually, and he succumbed to it. So this is one example where I feel even funds for Ayurveda is the need of the hour. At present, I would like to use this opportunity to tell that even Ayushman Bharat or ESI insurance scheme, 5 lakhs or 12 lakhs, is very much available for patients receiving modern medicine treatment. At the same time, when we have to treat a patient with Ayurveda, depending on the affordability of the patient, we have to plan the treatment. This is very sad to say this. I cannot give the best treatment available. So, even funds available, even though we have collected through our cancer foundation, it is not available to handle the number of cases we are receiving now. So I feel one thing we should convince our lawmakers is to give insurance for Ayurveda. This is the need of the hour, I feel. And most of the people, even it will be clear in the further reports, they suffered because they could not continue the treatment even after getting very good recovery. This is another example. Again, I'm concentrating here on the antibiotic resistance. Fungating, ulcerating breast cancer. The patient was on palliative care, and the patient was sent back from the hospital. If you see the cloth, almost there was almost a half liter of pus discharged from the malignant ulcerating breast cancer, and her WBC count. This report was done on blood test was done on August 2nd. It was 54,000, around 55,000 from the last 6 months. I checked in our laboratory computer. From 6 months, it was fluctuating between 55,000. And after antibiotics, it used to come down to 40,000. Again, it used to short, the counts used to shoot up to around 55, 60. So in spite of trying all our antibiotics, the WBC count did not come down. And after we took over the treatment, after she was sent back home, and she was not in a position to, she was on palliative care on morphine, she was drowsy, so she stopped all allopathy medicines. After we started Ayurveda treatment, within less than a month, counts came down to 22,000. She had significant symptomatic improvement. Doctors sent her home saying that she would survive for just 4 days, but she survived for 5 months. So, and I feel when we speak of in palliative care or any disease, at present we are just interested to speak of the quantity of life, where the person survived for 5 years, 10 years, or we have been able to increase the lifespan of our population to 6, 7 years. We are not discussing about the quality of life of individuals. So definitely, when it comes to improving the quality of life, definitely Ayurveda will play a very big role, I feel. These are some of the few examples of emergency management using Ayurveda medicines.
Swamiji wanted to ask a question about infectious diseases.
Dr. Ashwath, namaste.
Sorry, namaste.
A question will be useful for many because not only in Kerala but everywhere, people tend to take both the medicines, Ayurveda and allopathic medicines. So, what is your advice for them? How to combine them? I am also curious to know whether in acute infections, I understand that from your talk that Ayurvedic medicines also will help in utilization of the antibiotics in a correct manner. So, can you throw light on these 2 points? How to combine Ayurveda as well as the allopathic medicines in a practical way? How to take them, and how to use Ayurvedic medicines in acute infectious conditions. This is my doubt.
Yes. Sorry, when it comes to infections, to be frank, as an allopathy physician, till now I haven't prescribed antibiotics to even a single patient. In the last few years, definitely when we are working in an institution, definitely we have to prescribe whatever the institution follows. But outside the institution, in my private practice, not even a single patient I have given allopathy medicines for infection, even in acute stages. Let it be, and even in case of antifungals, many patients had come to me with fungal infection, with itraconazole, fluconazole, taking for months together. They had no relief. I stopped all the treatment, like antibiotics, which they were taking from months together, especially dermatological conditions or non-healing ulcers, where the patient did not respond to antibiotics. And especially when it comes to infections, I feel Ayurveda will benefit in a very big way without antibiotics, I feel. But at the present situation, where we use antibiotics for everything, it is very difficult to convince the patient sometimes. They feel taking antibiotics is safe. Side by side, Ayurveda will be a supportive treatment. I feel what happens is when we speak of antibiotic resistance, maybe there may be a situation where the next generation, maybe in the 20, 30 years, a child might die of having a very small wound. Because we are all actually, especially the healthcare workers, we are harboring MRSA or methicillin-resistant Staphylococcus aureus infections in our body. So especially people who are working in hospitals, they're at the risk of having resistant organisms in the body. So I think further use of these antibiotics will further worsen the situation in future. I think instead of alarming when the crisis arises, it is better to take the right step at the present situation itself.
Yes, so thank you for that answer. Just one question. I mean, what you are saying sounds, you know, too hard to believe for many people that so much can be done with Ayurveda. So let me ask: have you found situations where Ayurveda didn't work or it fails? I mean, completely perfect. So where it may not work or
Sir, there are many cases. For example, I think when we refer at the right time, I think there will be very less situations where we can say that Ayurveda has not worked. I think definitely in cases of, for example, in cases of I felt in pain management, uh, the modern medicine will be of great relief in providing immediate pain relief. I'm not saying there are no medicines available for immediate pain relief in Ayurveda, but many of us are not aware of it. So these are some areas I feel, and when it comes to immediate stabilization, especially in road traffic accident, when there is a structural abnormality, when we have to fix the structural issues, I think definitely modern medicine plays a very big role. And as we have lost the techniques of Ayurveda surgery, we have to definitely allow modern medicine to take over, I feel. Ready for now. Um, Mamla. Sorry for the interruption. Yeah.
yes. So continuing, I mean, what do you think? I mean, one of the basic major problems is, we have seen a lot of allopathic doctors also, seeing the benefits of Ayurveda. We have a very eminent oncologist in Kerala who is using Ayurveda and Siddha in his clinical practice for cancer. But on the whole, even if these kind of experiences are there, doctors are willing to maybe acknowledge it personally, but not formally. What is your own experience in your hospital? I mean, how are your colleagues and seniors and heads of the department responding?
Sir, as said before, initially, as it is a scene everywhere. Initially, they feel Ayurveda is of no help in case of emergency, or in case of malignancy, or in case of conditions where we need immediate result. But once I showed them the documentation of the treatment results from all these years, definitely they were interested, and they supported me either in the undergraduate institution or the PG institution, and they wanted to take it forward, because many a times the fear is tomorrow if my family member, as an allopathic physician, if my family member is in a critical condition, I want to use this medicine. So the present state is like that. We cannot deny the role of any other intervention in crisis, because everyone want to get out of it. Does not matter what is the situation. And as I said before, there were many questions people asked regarding why studies have not been done, etc. Or why the efficacy, what other ways can you prove the efficacy? Why can't we do randomized control trials, etc. But I had very good discussion with my friends. I tried to explain how Ayurveda medicine works in terms of modern physiology, pathology, medicine, etc. And on what basis Ayurveda theories were framed, we discussed even those issues. For example, I explained them what is the meaning of different pramanas or different truths in Ayurveda, and how Ayurveda theories were formulated. And when they wanted me to do different studies, uh, I would like to share some presentations. For example, I gave them this example of a book written by Padma Bhushan Dr. M.S. Valayathan, who is a cardiac surgeon and Ayurvedic scholar of undeniable repute. So he has written, translated Charaka Samhita, Sushruta, Ashtanga Hridaya, etc., translated to English. And this is how I strengthened my concepts in Ayurveda. So in such cases, when they had doubts regarding why this cannot be, RCT cannot be done, what is the proof of using this medicine, etc., I showed them some of these his books writing, where we cannot separate the individuals, unlike in modern medicine. In case of randomized controlled study, as we treat the patient based on the Prakriti in Ayurveda, every patient is different. So we can not club the patients to two groups. And what I feel is, for everything we follow World Health Organization, but except for, this is the book of WHO guidelines for research in traditional medicines. So even he shows his disappointment in the very first photo here. First, in 2000, in the year 2000, WHO has given a separate set of guidelines for research in traditional medicine. In spite of that, we are very much reluctant to follow the guidelines of traditional medicine when it comes to Ayurveda. And I feel we cannot apply the rules of modern medicine when you do a study in some other system of medicine. And if we do so, the results will be seriously compromised, I feel, because the concept of Ayurveda medicine, like rasa, vira, vipaka, or the taste, potency, or the final transformation of the subject, etc., when we study such topics, in vitro and in vivo studies are not applicable in many times when it comes to Ayurveda. So, and another concept of Ayurveda, WHO has clearly mentioned when it comes to traditional medicine. I convinced my friends that no need of any further trials, because WHO has clearly mentioned that in case of traditional medicine, the long historical use of the medicine itself is a testimony to its safety and efficacy, especially at least the safety of the medicine. So, which was taken by thousands of years by human beings. Now we need not test it by giving it to rats and then approve it for humans. This is a blunder we are making, I feel. And another thing I should, I'll take just 2 minutes to inform some of the guidelines which was given in the WHO. One thing is, another thing we have to keep in mind is seasonal variation. You know, example is Vata disorders, joint pain, etc. will worsen in case of winter season. So in such conditions, if you do a study in winter season and summer season, the response of treatment, either Ayurveda or allopathic medicine, will be different. So another thing is, we should evaluate traditional medicine in its own theoretical framework. So otherwise, as I said, the results will be disappointing or very much compromising. And I feel like most of them say, this is just when I present a case to them, they say this is one case. We want 100 such cases like in modern medicine to prove the efficacy. But WHO has pointed even this important point. In traditional medicine, treatment is based on the specific needs of the individual. Therefore, single case studies should not be ignored. So this is a very important and valid point I would like to make here. And uh, another thing what we want to do is, in modern medicine we treat only the physical body, but when it comes to Ayurveda, it is not only treating the physical body, it treats the person in a spiritual way, environmental, mental, everything, every well-being is taken into consideration. In short, it is a holistic treatment. So we cannot apply the rules of conventional medicine to this holistic treatment. We should definitely monitor different treatment modalities when it comes to traditional medicines. And very important point, another important point which it has made is, personal experiences in traditional medicine has to be respected more than clinical trials. These are some of the points which we have neglected since long. And I think if we take into consideration these issues, definitely, and after I explained my friends about all these issues, now they're not asking for any evidence. In fact, they are convincing their family members, their friends, the efficacy and safety of Ayurveda medicine. And to be frank, more than 50% of the patients what I'm having, they're either allopathy doctors or their family members, etc. So it is not difficult once we sit and discuss, once we have cross talks, once we try to overcome the misconceptions. Definitely, I think it should not be a roadblock for any further development.
Yes, so there is just a few more questions, before we open up to the audience if they have any questions. Uh, One is, of course, we just saw a comment that you are doing a amazing work, and this has to be built up very carefully, because with documented, and it would indeed be very useful if all this gets published at some point of time, in some good reputed. Do you have any plans actually for publishing your experiences in a journal?
Definitely, sir. I'm looking forward to publish. But as I said before publishing, we need to get the clearance from ethical committee. Once again, the problem is they want to evaluate all this medicine, applying the rules of modern medicine. So I think publishing work can be smooth if we are a little bit flexible when it comes to traditional medicine. I think we should respect the principles of alternate system of medicine when we are trying to like publish where the authorities of modern medicine, I feel. Definitely, once there is some
Yeah, I
relaxation,
think
many Ayurveda doctors will come forward to publish. Most of them wanted to publish. They went to ethical committee and they did not get clearance. At present, I'm convincing the members of ethical committee the the differences in the way two systems of medicine work and how we should give some relaxations when it comes to Ayurveda medicine.
yes, but you know, there is when you want to do a study, there are ethical issues. But when you are going to publish case reports and outcomes, it's not so difficult. So that could be a starting point, is what
Definitely,
I
I'm
would
looking
like to
forward
suggest.
to it.
Yes, yes, because studies and all that big research will go through scientific ethics committees and will face a lot of blocks. But as a practitioner, your experiences collaborating with your own senior Ayurveda mentors, you could, you know, easily publish some of these outcomes. That is what I
Sure, sir,
feel.
definitely. I'll do it with my seniors' guidance. Definitely, I will be looking forward to this.
A few personal questions. A lot of people wanted to also ask that. You have such faith in Ayurveda, perhaps even more than many Ayurveda physicians who are graduating out of the colleges. But then, what made you study modern medicine and also particularly surgery? I mean, you could have easily become a very successful Ayurvedic practitioner yourself.
Yeah. Answering the first question, why did I choose modern medicine? Brief about background, as I saw some comments regarding some people asked about my background. My mother is an Ayurveda practitioner, and my father is an integrated practitioner. He has done both Ayurveda and allopathy course. So since childhood, he encouraged me to understand, look at a particular disease in the eyes of both the systems of medicine. So we will get a better picture. For example, when we say many of our diseases are idiopathic in modern medicine, a clear explanation is given in Ayurveda. So then I felt instead of joining Ayurveda, I felt it's better to learn or get trained in modern system of medicine. As I had training from my parents in childhood, the simpler concepts of Ayurveda regarding the lifestyle or the diet or the simple case scenarios, etc. I thought if I be in the field of modern medicine, definitely we can combine, we can take the two systems in a much better way. And another point I want to make here is, if I were to become an Ayurveda physician, as we know, it is difficult to convince people. If an Ayurveda physician tells Ayurveda is good, very few people listen to it. So as I came to modern medicine, it is easy for me to convince people regarding the effectiveness of Ayurveda treatment. They readily agree to whatever I say. Even now, actually, many of them have video call with me, chat with me regarding the reports. I counsel them. Only then they start taking Ayurveda treatment from my parents. So it has a distinct, coming to modern medicine has given me a distinct advantage of convincing patients with ease. And second, answering second question, why did I take up surgery? For example, as I said before, my father is practicing integrated medicine from the last 35 years. So similarly, I felt there is a very great scope for integration even in surgical field. So for example, and I felt having Ayurveda along with me, if I take up surgery, I can avoid many surgeries. I would like to make some case presentations just to, as an example. Especially we know in case of like benign lesions like fibroadenoma or cyst of breast, or where the person has to undergo repeated surgeries like pilonidal sinus or repeated surgeries for fistula in where there is limited results in modern medicine where the recurrence chance of recurrence is very high. I think integration of such topics into Ayurveda or in the treatment of surgical Ayurveda can be of great relief. For example, this is the actually the report which was done through using the device iBreast exam scan. This is the device which we got from US, which is primarily to screen breast lesions, and we are the first in Karnataka to use this device. And studies have shown that the sensitivity and specificity of this device in detecting a lump is same as that of mammography. So, for example, we know in case of recurrent fibroadenomas, women have fibroadenoma of breast. They are operated twice, thrice. again there is a recurrence. So in such cases, this is one example where I did the scan on 11th March 2019, showed this is actually recurrent fibroadenoma. She had already got operated. Again, there was recurrence in the same side of the breast. So after, and in such cases where using Ayurveda medicine, we can avoid the need of surgery. And what I felt was even the chance of recurrence can be avoided to a very great extent. After 1 month, the fibroadenoma had disappeared. So in this way, the need for surgery can be avoided in many of the conditions when we have Ayurveda along with us. And as I said, when it comes to non-healing wounds, especially diabetic wounds or bed sores, etc., where it is a very big headache, or when it comes to orthopedics, chronic osteomyelitis is a very big headache for orthopedicians. Even during my UG days, I felt people used to come they used to keep coming from years together. Even the gentamicin B, it used to get infected. So, and we have, for example, how we can go retrospectively is, for example, in case of we say medicines are effective only in case of acute osteomyelitis. In case of chronic osteomyelitis, as there is granulation tissue formation, medicines do not penetrate the infected tissue. So medicine is of no use. We should give surgery is the first line of treatment. This is what we say in modern medicine. But I have a lot of cases where we have treated chronic osteomyelitis successfully, which was maybe after sternal osteomyelitis after bypass surgery, or distal femur or proximal tibial non-healing osteomyelitis after RTA, which were not healed after even 5 years, 10 years, were completely healed after 1 month. So now in this way, I can go retrospectively and see, when we say in modern medicine, granulation tissue will not allow the penetration of medicines. Did these Ayurveda medicines increase the growth of vascular endothelial growth factors at the site of wound, etc.? So in this is one example how having knowledge of Ayurveda, we can do many retrospective studies in modern medicine. And definitely, we may develop new receptors and molecules. As we know, like many of the, to explain Ayurveda, having limited modern medicine parameters is not enough. We may have to develop many new receptors or molecules or blood parameters. So, and this is another example where the person had dermatitis, and he's actually 80-year-old, 78-year-old male, diabetic and hypertensive and asthmatic. He had this problem from almost 2 years, and once he went to dermatologist, the infection worsened and he developed swelling of the leg, and they got worried that he might develop DVT, etc., looking at the swelling of the leg. So they referred to a surgeon, and surgeon tried to treat the infection. They gave hyperbaric oxygen treatment, which will be very helpful in this condition. All these treatments, antibiotics did not work up. Again, they went to dermatologist. So the patient was constantly shifted from dermatologist to surgeon, but without any relief. And the second photo shows after 2 months of Ayurveda treatment, the lesions have completely disappeared, and the patient had very good glycemic control also. And the last photo shows after almost around 5 months of treatment, even the swelling of the leg has come down significantly. The quality of life had improved dramatically. The person who was actually confined to home started going out to functions, etc. after 5-6 months of treatment. In this way, I think having Ayurveda and surgery will be of very great benefit. And along with this, there are some unexplored, not much explored paths. For example, we have a lot of surgical incisions. At the same time, we have many marma points, maybe in the limbs or in the entire body. So many times, as we know, Shushruta has said one important point: knowing marma chikitsa is nothing but knowing half of surgery. So this is the reason I took up surgery. These are some of the points which made me to take up surgery. I think now we see in case of post-op, when the patient is operated, and in a span of just 2-3 days, they develop some serious illness which is not related to the primary disease, or even not even related to the post-op complications as we expect. It is maybe we have damaged some important vital marma point, and this is the reason I think some of the areas. And what I'm planning is, in future, if I get an opportunity discussing with experts from both the fields, we can modify the present incisions so that if it is crossing through any marma point, without compromising the access to the organs. So in this way, the recovery of the patient can be fastened, I feel. And for example, in case of, I read somewhere, in case of Indrabasti marma, where local heat therapy given to Indrabasti marma, this is in the lower limb, Indrabasti marma, they say any lymph node swelling, either tubercular lymph node swelling or malignant swelling, the size can be regressed to a very great extent. So tomorrow I can use cautery or just as a heat therapy to that point, and in this way I can integrate the two systems of medicine even in surgical aspect, I feel.
Yes, so thank you very much. We will take some questions if there are any questions from the participants. Many of the questions, came in between. There was one question from Rakesh. He is asking, did you get a chance in treating a tracheostomized patient with Ayurveda? So, if so, how would you administer the medicines?
Sir, because the place where I'm working, usually COVID patients are not tracheostomized. I spoke to my friend a few days back who is working in a private institution. It depends on, the line of treatment varies slightly from hospital to hospital. Where he said me, instead of keeping the patient intubated, where the patient can have secondary bacterial infection, just after 4 to 5 days of intubation, they go for immediate tracheostomy in some institutions. But till now, I haven't got any chance to treat tracheostomized patients. I don't have much experience in treating such patients.
Yeah, but you were also talking about, esophageal cancer, where you felt that, Ayurvedic medicines could be directly. Could you just, say a few words about that?
Yeah, yes, sir. I know. Actually, he's my mother's batchmate practicing in Udupi. So he's actually an Ayurvedic surgeon. For example, if a patient comes with esophageal cancer, definitely we need to do diagnostic endoscopy, take a biopsy, etc. At the same time, there are some topical anti-cancer medicines very much potent available in Ayurveda. What he's doing is he is going through the endoscope route, scratching the tumor, and once a tumor starts bleeding, he usually sprays those medicines at the level of mucus and submucosal levels. So medicine will have local absorption. And there is one report which I saw recently, which was actually delivered in one of the webinars. So after 3 months, there is complete regression of the esophageal tumor. So in this way, we can dream of, in case of, if this works out very well, when we replicate in large number of individuals, instead of going for standard treatment like esophagectomy or gastric pull-through surgery, endoscopy, we can dream of endoscopy having as both diagnostic and curative treatment for esophageal cancer. Definitely, when it comes to Ayurveda, sir, definitely the role of Ayurveda is, extensive when it comes to surgical integration of modern medicine and Ayurveda.
So, thank you very much. Do you have any other interesting slides or something to share? Otherwise, we would like to go to the next remarks from our professor. But if you have any more slides, you could please show them and then we will move on.
Sure, sir. And another area of interest is cancer care, where people think there is no medicine in Ayurveda for cancer. And most of them think once they get diagnosed with stage 4 cancer, nothing much can be done. And in such cases, Ayurveda, definitely they will not come to Ayurveda. Or in some cases, when modern medicine, there's not much option in modern medicine, then they come to Ayurveda. And most of the time, why people don't come to Ayurveda? The answer they give me is Ayurveda is slow. So as I said before, Ayurveda is not slow. People coming to Ayurveda has become slow in each and every disease. And according to my experience, what I feel is many of the stage 4 cancer patients, what we label, many of the time they are still stage 1 when it comes to the treatment available in Ayurveda. So most of the time I convince patients and say them, you do not lose hope when we label as stage 4 in terms of modern medicine. Definitely there is a scope for improvement or recovery. And most of them come to Ayurveda for palliative care. And most of them, we try to convince them the purpose of Ayurveda is not only palliative care, that is symptomatic relief. Along with that, simultaneously, we can plan for curative treatment also. These are some of our, I would like to present 2 interesting oncology cases treated with only Ayurveda medicine. This is the history of 73-year-old male, our relative, who was diagnosed in the month of July last year with hepatocellular carcinoma primary. If you see the around 10 into 9 centimeter, and metastatic lesion in the lungs 5 into 3 centimeter with adrenal mets. Considering his age, oncologist said it is better to give only symptomatic management, better to avoid chemotherapy. or any other modern medicine intervention. So, and they came to us treatment in the month of December after almost 5 months after being diagnosed. So after 2 months of treatment, definitely he had some weight gain, improvement in appetite, etc. And the patient was curious to know the extent of improvement. So they wanted a scan, so we sent them for CT scan. And this is the report. This is my father's name, Dr. Ashwath Rao. And the scan was done approximately 2 months after starting the treatment. And if you see, interestingly, the size of the liver lesion is same. They say no, now showing no significant interval changes. But when it comes to pulmonary metastatic lesion, when compared to previous PET CT study, there are no pulmonary metastatic lesions appreciated. I have made this in a tabular form to make it simple. 18.7, these are the measurements, pulmonary mets and adrenal mets. Ayurveda treatment was started in the month of December, and in February, no pulmonary lesions, no adrenal mets. And I'm not satisfied with the description of the scan because hepatic lesion was around 10 centimeter in the month of July. Definitely, in the month of December, it would have become 15 centimeter, 13 centimeter, etc. And when they say it is now 10 centimeter, definitely even the maybe it is not possible to describe in the CT scan. We can assume that even the metastatic liver lesion also has come down. And this month, July 2021, it is almost 1 year since the modern medicine doctor said him that he would survive for a maximum of 2-3 months. Even after 1 month, he is doing very good. He is not aware that he is a cancer patient because old people tend to go psychologically weak, so their children have not informed them. This is how we can plan many of the palliative care treatment into curative treatment using Ayurveda medicine. Another interesting case, especially in cancer, not only cancer, along with and what I feel is especially in case of oncology, very important point to make. This is given in our Robbins textbook of pathology. 40% of the deaths in cancer patients is due to the side effects of chemotherapy and radiation. I'm not saying this. This is mentioned in our Robbins textbook of pathology in 6th chapter, neoplasia. So now the question comes, so definitely if we combine Ayurveda and chemotherapy or radiation, we can avoid this majority of the deaths which are happening due to chemo or radiation. And I feel in terms of cancer patients, now we are worried about only 5-year survival, 10-year survival, or the quantity of life, as I said previously. But quality of life can be significantly improved using Ayurveda medicine. This is one example which I want to, a very interesting example. Especially in lower GI cancers, either of the colon or intestine or gastric malignancies. Usually people bleed till death. The usual history I have seen is they are transfusion dependent. Their hemoglobin will drop to 5-6 due to continuous bleeding. And they go to hospital every week or 1 week. They transfuse 1 or 2 pint of PRBC or blood. They come back, the hemoglobin will improve to 9, again it will come to 6. So in this way, they bleed till death or they're transfusion dependent or they keep going to hospitals every now and then. This is one example case of urinary bladder carcinoma with colon mets of elderly male, 69-year-old elderly male who had initial hemoglobin of 7.24. And this is after repeated transfusion. The son used to say me the hemoglobin never went above 9. After transfusion, it used to reach up to 9 and again 6, 7, again 9, 6. This was happening from the last 6 months. And initially, the WBS count was very higher. When I started treatment, urea was normal and slightly deranged RFT. And within 2 days, they repeated the test again. They were very curious to know, because when patients come to me, I say them, like, just try the medicine for 1 week. If you don't find any benefit, you can stop the treatment. So in such cases, we cannot, in critical condition or when the suffering is immense, I cannot ask the patient to wait for 2-3 months. So most of the time, we ask the patients to continue treatment for 1 week or 15 days and then discontinue the treatment if there is no benefit. So as I said, you will see the results in 1 week. They were curious to know what will happen after 2 days. So without asking me, they repeated the blood test and HB was 7, same. We cannot expect hemoglobin to increase so rapidly. But total leukocyte count has come down without any antibiotics and deranged RFT has corrected this. I have a lot of such cases where after starting Ayurveda treatment, definitely RFT or LFT which was deranged has corrected. And interestingly, within 1 month, hemoglobin has increased to 10. This is only on Ayurveda treatment. I did not give any hematinics or any iron supplements, no non-vegetarian diet, no transfusion. So these are some of the things, even if you are able to avoid the need for recurrent transfusion, this itself will be a big contribution, I think, in improving the quality of life. And another important thing which I want to point out, for example, in acute lymphoblastic leukemia, we had a case in acute myeloid leukemia, where a child was planned for bone marrow transplantation. Usually after chemotherapy, there will be weight loss, and oncologists will wait for weight gain before bone marrow transplantation. But even after waiting for 5 months, the child had never weight gain and he was never fit for bone marrow transplantation. Then he came to take Ayurveda treatment. He had significant weight gain, around 5 kg weight gain in 2 months, and he went back and completed bone marrow transplantation. In this way, I feel wherever we have roadblocks, wherever we feel our modern medicine doesn't proceed smoothly, or wherever we are likely to get stuck, definitely we can make use of Ayurveda treatment to make it proceed smoothly. Or I have many patients who are on chemotherapy, where there are some drugs, chemotherapy agents, which are known to cause weight loss or drop in hemoglobin content, etc. But the patients who are taking Ayurveda treatment along with chemotherapy, oncologists are very happy because on chemotherapy they are having weight gain. On chemotherapy, like the hemoglobin is improving. They have no side effects like nausea, vomiting, weight loss, or tiredness, peripheral neuropathy, etc. I think it can make a very big difference when we combine modern medicine in terms of oncology, Ayurveda, and modern medicine. So, and another very interesting case which I would like to share in this platform. This is the case of a 70-year-old male who was diagnosed with metastatic adenocarcinoma of lungs with unknown primary. They conducted n number of investigations like triple endoscopy, etc., but they could not find the primary. And we know most of the times, like in elderly males, they will not be able to tolerate chemotherapy, and he was started on osimertinib. And just after 1 week of treatment, he started vomiting. The symptoms were like in a span of sorry, in a span of just 3 months, he had almost 8 kg of weight loss from 52 to 45, 7-8 kg of weight loss. And he had severe breathlessness. On further evaluation, he had 2.5 to 2.2 centimeter primary lung mass lesion with mediastinal lymphadenopathy. So, and he had a massive pleural effusion on the right side. He developed later, and his condition was almost, doctors used to tap 1.5 liter of pleural effusion on alternate days. This was his condition. And once he could not tolerate the immunotherapy tablets or osimertinib, he came to us for palliative management. And within 2 days, his cough, which he had from almost 3 months, has completely disappeared. And another advantage is where the patient is, for example, dependent on tapping in case of pleural effusion or ascites, as I said before, Ayurveda can be of great help to decrease the pleural effusion without tapping. There are very good medicines in Ayurveda which can decrease it rapidly and give very rapid symptomatic improvement. So, and the person after this patient had 3 kg weight gain every month approximately, and had almost 8 kg of weight gain in a span of 3 months. So, and we repeated the CT scan on July 17. This was on April, almost 3 to 4 months later. No obvious mass lesion seen and no evidence of mediastinal lymphadenopathy. So these are some of the cases where people come for palliative treatment, but still using Ayurveda medicine, definitely we can plan for a curative treatment. Another interesting case, this was a case of a 58-year-old female who presented with actually a post-menopausal bleeding, and she underwent hysterectomy, and even the histopathology report came as normal. So they anyway, obviously they did not, oncologist or the treating physician, gynecologist, did not suspect any malignancy. So they said nothing else is required. No radiation is required. So after 2 years, she developed a significant swelling on the left side of the neck on the level 4-5 lymph nodes. So, and it was around the size of lemon, 4 to 2 centimeter. And on further, she had mild abdominal discomfort, etc. And she had one small swelling in the inguinal region also. On further evaluation, this is on 19/6/2019. In the region of neck, multiple lymph nodes, 4 to 2 centimeter, and in abdomen, around line of aorta, celiac axis, retrograde lymphadenopathy, etc. Multiple lymph nodes, largest 4 to 3 centimeter, pelvis also multiple lymph nodes, and inguinal also multiple lymph nodes. Even proximal thigh, there was a single node. And doctors had said her that she would, in spite of chemotherapy, she will not survive for more than, because it's a rapid, they diagnosed her as after FNAC as metastatic adenocarcinoma with unknown primary. But the reason we know most of the time in the history of post-menopausal bleeding, the histopathology report might have been missed to find primary foci. So in such cases, they were counseled, the patient party, without chemotherapy, the patient is not going to survive for maybe more than 2-3 months. So definitely they thought the patient relatives decided to give her better quality of life, as they have seen some of their friends and family members, they had the fear of chemotherapy. So even when we come here, we give them we don't assure them anything, but we assure them only the best quality of life, not the quantity of life. And after 6 months, we repeated PET scan. The neck lymph node 4 into 4 centimeter has become nil, and the description of the PET scan, the number of lymph nodes in the region of abdomen has come to half. Largest 4 point, size has come to half, number has come to half. Even in the pelvis, it has come down to a very great extent. Inguinal and proximal thigh again nil. This is the description of the PET scan. As compared with prior PET CT dated 1906, there is moderate to marked regression of cervical, retroperitoneal, iliac, left inguinal lymphadenopathy. So, and after another 6 months of treatment, she suddenly developed ascites. So, not 6 months, after 8 months of in the year December 2020, she developed ascites. So, she did not respond much, but she had a very good quality life. She had ascites and she had breathlessness, pleural effusion. Then she did not survive long. So, but even though 1 year 8 months was a very good quality life given to her, definitely even we get to learn many things. We will sit back and discuss. I would like to usually discuss such cases. What went wrong after 6 months? How are we supposed to plan the treatment? And definitely our intention is when a similar patient comes next time, I should be able to avoid this complication of worsening the disease, or maybe we should be able to give the same result what we give in 6 months in a span of 3 months with half of the treatment cost, etc. And when it comes to oncology, even many people have asked me, how can you deviate the standard line of care, etc. But many a times, what cases we take in are elderly patients who are not suitable to receive chemotherapy. We take such cases, or many a times, even modern medicine says that, for example, there are 4 histological varieties in endometrial carcinoma. The 4th variety is clear cell endometrial carcinoma. They say that is the least common variety, around 3 to 4% of the endometrial cancers, but it is the most malignant and the worst prognosis. And I have gone through a lot of studies where they have said that with or without radiation, the 3-year survival is just 15% in case of clear cell endometrial carcinoma. So whenever such patient comes to me, I am justified in starting Ayurveda treatment because studies have shown that with or without radiation, the survival rate is there is no difference in the rate of survival. And another important case regarding, I would like to include 2 cases of interesting endocrine cases also. Most of the time, they diabetics are started on insulin when the glycated hemoglobin is more than 9, etc. But in the last 2 3 years, I have treated many diabetics and hypothyroid cases, endocrine cases, and not even a single case I have prescribed metformin or glimepiride or insulin. And only on Ayurveda medicine, they have responded tremendously. This is one recent example where 64-year-old female had weight loss, the usual symptoms of diabetes. She had polyuria, polyphagia, frequent urination at night, etc. And on evaluation, her glycated hemoglobin was 12.54%, and even obviously the urine will show 2 plus sugar, etc. And I started on intense Ayurveda treatment like TID dosage with some kashayas, tablets, etc. And within 2-3 days, she found much better, symptomatically better. The tiredness had dissipated, etc. And even sleepiness, the frequent urination, etc. These are the first changes which we see when the person responds to Ayurveda treatment. Then after almost 4 months of treatment, the HbA1c has come to 7.19. I have many n number of cases, diabetic cases, even if the HbA1c is as high as 12 or 13, only on Ayurveda treatment, rapidly, we can get it to normalcy. And another important problem of long-term diabetic complications like peripheral neuropathy or autonomic neuropathy like diabetic diarrhea or postural hypotension, or many cases like chronic kidney disease, which is difficult to reverse, they easily respond to Ayurveda medicine in a span of week or 10 days. And I feel I've seen many people telling the peripheral neuropathy, in fact, they have taken Meganuron OD plus for 10 years. No, it has not responded. Just after 1 week of Ayurveda treatment, they say it has completely disappeared. So especially why I want to put this point here is, I read somewhere from the beginning of this pandemic, most of them are working from home, not much of lifestyle, not much of physical activity. In such cases, I read less than 30 years of age, 30% increase in diabetics. This is the news which I read in our this is recent news coming out from one of the journal. So in such conditions, I feel even in endocrine disorders like diabetes and hypothyroid conditions, Ayurveda will be very useful. This is another interesting case where the 42-year-old female came to me with symptoms of weight gain, hair loss, proximal myopathy, all the usual symptoms of thyroid. She has menstrual abnormalities, etc. And I suspected any thyroid disorder. It is very, very easy. And on further evaluation on 5th June, this is just before I joined for my post-graduation, her TSH level was more than 150. And we know, like, she immediately wanted to start thyroxine because her sister is taking thyroxine from last 10 years, was taking thyroxine from last 10 years. So I took 2 hours to convince her and explain her the difference between replacement medicine and regenerative medicine. When the thyroid gland is present and when it is not functioning, if we give further, like start thyroxine, it will result in further dormancy of the thyroid gland. The thyroid gland will become further dormant. Instead, it is important to kickstart the functioning of the thyroid gland. So I explained the treatment modalities in the 2 systems of medicine. And I convinced her that let us try for 1 or 2 months or 3 months. Let us repeat the TSH. If it doesn't improve, definitely there is option of giving thyroxine. And one important side effect which you don't discuss of thyroxine is osteoporosis and the chance of becoming diabetic. And interestingly, I have asked this with many women or many people, many patients who have taken thyroxine for like 10, 15, 20 years. They either have backache or joint pain or their bone mineral density test is showing osteoporosis or they're diabetics. So in such cases where the person has to depend on lifelong allopathy medicine, either diabetes or thyroid disorders, Ayurveda can be of great benefit. And this was the report which we repeated on 5th October, exactly 4 months after starting the Ayurveda medicine. TSH has come back to almost normal, absolutely normal. So, and even the difference, what I've seen is who are on thyroxine, immediately I don't ask them to stop the treatment. I start along with thyroxine, Ayurveda medications, gradually taper the dose, maybe from 100 to 75, 50, 25, etc. So, and then gradually stop the dose of either anti-thyroid medications or diabetic medication, etc. So, this is for people who are already on allopathy medicines. So, initially, I don't start even like anyone on allopathy medicine, especially in these 2 conditions. And quickly, I would like to end by making some 2 important points. When it comes to integration, many people have asked me, if you want to like try Ayurveda, why can't like Ayurveda hospital set up separate and why can't you treat in their ICU, etc. We should see, like we should have some, interest in looking at what Westerners and Ayurveda, what is the link between Westerners and Ayurveda. And this is the example of an oncology expert, Dr. Dixon from UK. He feels integrative oncology is a need of the hour. And he says different system of medicine will be a boon to patient. And just 2 sentences I would like to quote from here. He says, do not deny the benefit to the patient because you cannot explain how it works. We may take few years to explain how Ayurveda medicine works, but till then I should not deny the benefit to the patient. And I should respect the patient needs also at the same time. And he says, time has come to come out of our textbooks and think what is best for the patient. And this is one interesting medical student from Germany, Jan Willek. He is a medical graduate from Germany and he himself is an osteosarcoma survivor. He came in the year 2018 to India just to learn Ayurveda. How he got interested in Ayurveda was his physiology professor in Germany was he was a supporter of Ayurveda. So in this way he got some interest showed immense interest in Ayurveda, and he came to India to learn Ayurveda and he visited different parts of the country. Similarly, when he came to KMC Manipal Ayurveda department, I met him there. Even I was doing my 3-month diet course when I was preparing for my NEET PG entrance. So I met him during that time, and he came to our home and stayed for 4 days. And my father, Dr. Ramesh Rao, who is an integrated practitioner and who has lit the fire of integration in me since childhood, he explained him the basis of our Vedanta philosophy, the basis of principles of Ayurveda treatment, etc. And it was a very interesting discussion for him. And when he left Udupi or Manipal, he almost took 2 dozens of Ayurveda books translated to German or English. I can see some of Charaka Samhita, Ashtanga Hridaya, or some of the books like Light on Yoga, Paramahamsa Yogananda. All these books, he felt it is very much important. He feels integration is a way forward. And this is the question he asked me. When the system of medicine is used from thousands of years, even he feels research is not required. It is enough if you have a regulatory authority just to prove the safety of the medicine. I think that is the need of the hour. When Westerners are so keen in integrating, I think we should not think much to bring the two systems of medicine together. And finally, before all of you ask, so like the final question may be like, so which one you think is more important? There should be some like advantage, either modern medicine or Ayurveda. So, but for them, the answer what I give is modern medicine and Ayurveda. These are like my two lungs. So, and the patient is my heart. So, if you ask me which lung is more important, no, I don't have any answer to this. So, when, as we know, when one of the lung, stops functioning, or in case of pneumonia, etc., the burden will be on the other lung. The other lung has to hyperfunction. So, I think when one system of medicine stops having its role in a particular disease, the burden will go on the other system. The other system has to spend more, has to work more, etc. And finally, we know when any one of the lung starts malfunctioning or hyperfunctioning, the burden will be on the patient. The brunt has to be taken by the patient. The patient is my heart. So in this way, I would like to conclude saying that without having any seeing any difference like superiority or inferiority, we should have a lot of discussion from different system of medicine, and our interest should be patient recovery. And definitely, we need a lot of like changes in the regulatory authorities also to make use of these medicines. And for example, as we know, most of them think Ayurveda is cheap. This is one very big misconception. For example, I want to take this opportunity to show a tablet in Ayurveda, where 10 tablet costs 2,200. For example, a tablet called as Jayamanu Rasa. It is very difficult at present to convince people that Ayurveda medicine is so expensive, and it is very difficult to keep the treatment in continuity. At present, as we know, we are spending so much funds for research or treatment, etc. In case of modern medicine, definitely spending some fund in case of Ayurveda to make use of these medicines will be of I think great help, I feel. And definitely, when more people start using these medicines, the cost of these medicines will come down. So, thank you.
So thank you so much. I think the last slide of the lungs and the heart aptly summarizes the final message. There are so many questions. I don't think everything can be answered today. We are coming to the end of our session. Online, it's difficult for people to be engaged, for a long period of time. But I'm sure we should have more discussions in the future. But let me ask a couple of questions. One is, what are the medicines that you're commonly using in practice? People are very curious to know that.
Yeah, we use a combination of both herbal and rasaushadhis. So, for example, like as the question is like what condition it is not being mentioned. I just want to say that we use a combination of herbal and rasaushadhis.
Right. So another question with which we will conclude, and then I would like to request Dr. Rajeshwari to come and give the concluding remarks. So one more question is, how do you approach the diagnosis? Because a disease may be understood differently from a modern allopathic point of view and an Ayurvedic perspective. To give an Ayurvedic medicine, we may need to diagnose it from an Ayurvedic viewpoint also. So how do you, approach this?
So I feel, irrespective of the way a disease is diagnosed, I think result is more important. So, for example, instead of spending time for me to like pulse diagnosis or nadi chikitsa, etc., being in the field of modern medicine, I can make use of the modern diagnostic techniques. So I think the way we diagnose should not make any difference in the treatment modality. Definitely, and it is for this reason I am in touch with many of Ayurveda experts, modern medicine experts, try to understand the disease in different system of medicine. And definitely, this is the reason I am not doing this treatment. And whatever results what we have got, we are not doing this alone. I am in touch with experts from the premier institutes of our country. allopathy, modern medicine doctors are supporting me, and many of the Ayurveda medical colleges staff, etc. They are in touch with me, and I am very much thankful um, to them for supporting me in making the right diagnosis when it comes to different systems of medicine. I feel when it comes to the mode of diagnosis, it should not be a roadblock to start the treatment, irrespective of the system of medicine. So I think in such cases, what I feel is right from OPD to ICU, intensive care unit, both the doctors from both the systems of medicine should be go hand in hand, I feel.
So thank you. I would like to request Dr. Rajeshwari to unmute your yes. And now I would like to invite Dr. Rajeshwari, who is the Associate Professor of the Department of Shalya Tantra at Amrita School of Ayurveda, to give some concluding remarks. And before I withdraw, I would like to once again thank Dr. Ashwath for spending so much time today and for enlightening us with very, very interesting insights on how Ayurveda can be applied in emergency to chronic conditions, from diabetes to endocrine disorders to cancer to COVID. Now over to Dr. Rajeshwari.
Good evening, sir. Can you hear me?
Yes, we can hear.
Am I audible?
We can hear you.
Good evening.
We can hear you. We can hear you. Please continue.
Good evening, Dr. Ashwath, sir. It was.
Good evening, madam.
I don't have any words to explain your contribution to our science. I just remember my days, like post-graduation in Government Ayurveda College, Bangalore, where when we were working in ICUs, we were asked to mug up some of the breathing system circuits and their names and all. So we were impressing the anesthetist, we were impressing the surgeons by doing all the works very promptly, and we were coming every day to the OT with maximum information what we can gather about particular case. Okay, maybe ECG or X-ray or MRI readings and all. But today, actually, it's a dream come true, like where our science is being understood and explained so beautifully, uh, and it is giving a complete uh, confidence to all our students, because whenever we were telling our students about the success of each treatment depends on how you diagnose a case and how you interpret that case. And once you understand and once you are diagnosing by using modern tools, you are going to get completely aware about where is our limitation, where is the scope, and where the modern system of medicine can intervene. So uh, such questions were answered in all these 10 years of my clinical experience. And today, I would proudly say that to all my students, whatever was we were teaching from all these years uh, really came true. Okay, so it's a wonderful session, sir. It was a very nice
Thank you.
session.
Thank you.
And actually, I want to add some points here. Just we were knowing the ICU care of patients like acute myocardial infarctions and also cerebrovascular accidents during our college days. Okay, our doctors, there were very few doctors who were dare enough to take such a cases during in their clinical practice, because this I couldn't see in my post graduation, but I could see this when I went to National Institute of Ayurveda for PhD. Okay, there were doctors who used to diagnose in a very fraction of seconds, and they used to give Ayurveda medicines where all the students in casualty were scared, and we were standing like, what will happen to such patients? So that was the exposure. But today we can actually confidently say that at 50% of confidence was there till now. Now we could get nearly 80% of confidence on almost all the acute cases. Okay. And I have pointed out some of the explanations given by you why you chose this particular profession, like modern medicine and especially general surgery. I remember one of my students' quote where she posted it in a social media, telling that when a success story was explained by me, the doctor should not always think about how to perform a surgery, but he or she also should think about how we can prevent some of the surgeries. So that became very true today. It's very nice to hear from you about that. And as a person from Ayurveda, I would just add few points related to the treatment which the doctor has adopted, because the questions were arised by so many of our students about the medications, what medicines was given, etc. So it's actually we all have to remember, and we all have to give scope on pathology of the particular illness, what exactly is going on in the patient's body. And once we understand the particular situation or a cytokine storm in this COVID-19, or if it is a immunocompromised patient, what exactly the pathology that is giving this high morbidity illness, at the time we can identify and we can explain all those pathology in terms of Ayurveda explanation, because all of us have studied the doshas, we have studied how dhatu works and how a medicine works, uh, what is the treatment mechanism is explained, and how this treatment has to begin. Everything is being told. So all those points we have to pick it up, and we have to give more and more importance to understand the pathology, what's happening there, so that we can move into a right direction of treatment. So that will be a point from my side. I think the doctor also will agree with me related to this,
Definitely, sir.
because in every patient, the same set of medications we cannot opt.
True, sir. Yes.
Every time the dose, every time the medicines will change based on the mechanism of the, or based on the response of the patient, based on the type of the illness. So every time we have to think about not the medicine, but we have to be very thorough about the pathology that is causing this particular illness. So we all have discussed a lot about the pathology of COVID-19 in the recent times. And when you look back all those pathological outlines, you can get a clear idea where you can use a Kajali, where you can use a Kshara Dravya, where you can use a herbal medicine, or where you have to combine both herbal and also mineral products. So that is the take home message for all of you. Do not entirely rely on the medications what our consultants or what our doctors or teachers are prescribing. Instead, go into the roots of that particular disease, so that you never forget that principles, because you may forget the name of the patient and name of the medicine, but you will not forget when such cases repeats in your practice, you may not forget such cases. So this is the wonderful information given by all our teachers, and also today it was proved by Dr. Ashwath sir. And one more about the high dose of medication. So every student will be surprised. A high dose of rasaushadis will be given in patients who are suffering from COVID-19. But when we see the explanations of treatment given in our text in fever, that is Jwara Chikitsa and Kasa and Shwasa, the number of dose of medicines is always multiple. You should not give like a BD dose or TAD dose is not advised. Instead, we are giving at a regular intervals in a very smaller dosage, or we are giving in a very larger dosage. So every principle, all the doctors are following here. So it's nothing but we have to get back and re-refer all our text, what is being already explained about the dosage forms. And in Jwara, it is a very simple point. The medicine is not given like morning and evening. Acharya says that until the fever reduces, you have to give the medicines in a prescribed dose for the at regular intervals, like how diclofenac or paracetamol is given at regular intervals. So that kind of explanations are also available. So it's the time for all of us to get back to into our descriptions in the textbooks so that we can get a complete idea about the particular explanation given by Dr. Ashwath. And the very next point was integration doesn't mean a mixopathy. It's an uh, absolute statement we often confuse with when a doctor prescribes or writes any investigation, especially Ayurveda doctor. The patient sometimes may feel very much agitated, or they may feel they won't feel good at times. I'm not telling about all the patients, or all our students who are sitting with us, they may feel that why this investigation is required or not. Because at times when we are unable to diagnose certain cases, when we are not so brilliant or not so talented to identify the mechanism of action which is going in our body, we may have to rely on some of the investigations or radiologic imaging techniques. But that doesn't mean that that is going to give a drawback to our science. Instead, as the doctor told, it's giving a lot of benefits to our science. Interpret the subject, interpret the impression of the reports, and plan the treatment. The patient will absolutely get relief in 2 days, 3 days, maximum 7 days. So that is the exact rule what I follow in my practice also. So even I have faced some of the harsh statements related to the investigations or excessive writing of some of the radiological imaging. So that will not be harmful most of the times, but it is going to give us the maximum information about certain cases. It's not very obvious. We are not writing very often, but there will be getting some challenging cases also. Anyways, uh, Doctor, I have
Excuse me,
experienced.
madam. With your
Yeah,
permission, can I take another 2 minutes with your permission?
sure, sure, sure.
I just want to make 2 slides presentation. I think without that, this session is incomplete. Just two
Okay.
sessions, 2 minutes. Uh, Sir, can you please switch on the slide? There is an interesting study done by Indian Medical Association Pune chapter in the year 2010. There, the important observation is average lifespan of Indian doctors is around 50 to 55 to 59 years, almost 10 years lesser than that of general population. If you see the life expectancy in India, average life expectancy is around 67 to 70 years. This study was done in 2010. At present, the life expectancy of the population has gone up. I think after 10 years, it has further come down. It might have come down to 50 to 55 years. This is the average lifespan of Indian doctor. When I compare this with the US, here in the lower part of the screen, the lifespan of the physicians is much more than any other professionals. So keeping this in mind, I have started a new concept, Ayurveda for modern medicine doctors, not only doctors, healthcare workers. I have given medicines to my seniors who are doing their MD exam, MS exams. They have felt a dramatic change in their physical and mental health. And some are taking from last 2, 3 years, 1 year, etc. And they have given a very good feedback, and especially where we are prone to develop non-communicable diseases. And it is said that the deaths what are happening early, like young age deaths, 30% of the reason is cardiovascular cause. So in such cases, I feel more than especially when it comes to on a priority basis, especially in times of COVID work. I have seen personally the healthcare professionals, the brothers, sisters in the hospital, and the doctors. They are psychologically, and physically, mentally, they are very much in a stressful situation post-COVID service for last 1 year, 2 year, and I'm sure we cannot forget the sacrifice of thousands of modern medicine physicians who have laid their lives in this pandemic. In such a situation, Ayurveda for modern medicine healthcare workers is very important and very urgent thing to be addressed. I feel. I think we can make a big difference in the healthcare of in the health of healthcare workers. At the same time, definitely it will be converted to better work efficiency of the doctors also. This one important point I wanted to make. Thank you, madam.
Okay, sir. It's really it's really needed in this present situation, because all the frontline workers are in too much stress, and as our most respected Devi Prasad Shetty sir was telling, in a short span of time we may not get just third wave of COVID. Instead, we are also getting a scarcity of doctors also in the future, near future. So we all should be prepared for that. And today, I'm very glad to say that even though we have treated only mild to moderate cases, and you have given a lot of confidence for all of us, including teachers and students, so that we can get back into our work with more and more enthusiasm than before. And as you said, when the patient is in the deathbed, it doesn't mean whether Ayurveda or allopathy or Siddha is working. Every doctor is worried about the life of the patient. Okay. So this is, if the mentality of each and every health worker or each and every doctor goes in this level, I think it will be a great change to Indian healthcare systems. So with that, I just say that it's a very good job from your side, and we expect your support in future also, because we are treating some of the cases, surgical cases, which can be treated in through Ayurveda, like anorectal cases or piloneal sinus, wounds, ulcers, and all. And as you are concerned, as you expressed, you are concerned on multi-drug resistant bacterial infections. So we are on the way to get success in that. In past 1 year, we are into that work also. I hope by another 1 year it will be complete for everybody, so that Ayurveda doctors can be relieved of. There is no requirement of any antibiotics or any of the in acute infective stages. Even all of us can just rely on all our medicines itself by giving absolute confidence to the patient. Okay. And with that, I just conclude my words, and I thank Dr. Ashwath sir for your wonderful presentation, and I thank Dr. Ramano sir for giving me such an opportunity to interact with you. And I just thank all the team of Achara for making or organizing this wonderful webinar, which is benefiting a lots of people, lots of students, and all are online today. And so many messages are coming about the medicines and all. We have to answer them one by one. And it was a wonderful session, sir. Thank you.
Thank you, madam. Thank you.
Thank you.
I would like to take this opportunity to thank Vaidya Ram Manohar sir and Amrita School of Ayurveda for giving me an opportunity, for giving me a platform to try to learn and understand, express my some of the case findings. And in fact, I want my seniors in this profession, both Ayurveda and allopathy, the cases which I presented, I want them to point out the mistakes, and if any mistakes in the approach to the cases, definitely I would like to get the feedback and correct myself. Thank you.
So I would now like to call Dr. Shyamasundaren to give the vote of thanks. Dr. Ramesh is also back here. Thank you for being with us till the end. Once again, thanks to Dr. Ashwath. I mean,
Thank you, sir. Thank you, sir.
No words. That was really mind-blowing and very inspiring for Dr.
Very good evening. Wow, what a session this was. It was really indeed very, heartening to see the, integration of Ayurveda and modern doctors coming together, and with a very unique and very sensible cause. So, first of all, let me thank Dr. Ashwath Rao for coming up to share your experiences with us, and spending so much of time, so much of your valuable time to share your experiences with COVID-19 patients in ICU, and also many other interesting cases like diabetes and the wounds and cancer and whatnot. So many cases you have explained, and it was indeed a very, very heartening experience to listen to you, sir. Thank you so much for your valuable time and patience to answer to the questions also. Next, I would like to thank Swami Shankaramritananda Puri, who is the medical director of Amrita School of Ayurveda, for gracing the occasion for the presidential address. He was also very interested to know about what the medications are given in the COVID-19 patients, especially in ICU, and how it is managed successfully. So he was also very interested to know about all this, and we really thank him for giving us the opportunity to conduct such a webinar. Next, I would like to thank Dr. Ramesh NV, the principal in charge, for the opening remarks. Sir also expressed his desire for, preaching the integrative medicine, which he had in his mind since a long time. So I think this will come true in near future with the steps taken, and people like Dr. Ashwath Rao, whose sincere efforts will give fruits in near future. Then I would like to thank Dr. Rajeshwari for her concluding remarks, because she had very well, also stated about the efforts being taken from Amrita School of Ayurveda and her own experiences regarding cases being treated with Ayurveda and in integration. So I would like to thank her also for the same. And lastly, I would also like to thank Dr. Ram Manohar, the research director of Achara and Amrita School of Ayurveda, for his efforts, for his sincere efforts. I would like to state here that it was him who actually was behind all this, behind this webinar, for organizing such a webinar, communicating with Dr. Ashwath Rao, and also getting permissions and setting up the time for organizing such an event. So I would also like to thank Dr. Ram Manohar sincerely for his efforts. And lastly, once again, I would like to thank Dr. Ashwath Rao for his time and his sincere efforts. May Amma bestow her blessings, immense blessings on you, sir. And we thank you on behalf of Amrita School of Ayurveda. Thank you. Thank you once again.
Thank you.
So I think with this, we will wind up the session, and we will go offline shortly. Thank you, one and all.